Infection control in operative dentistry. Today I will be talking about infection control in operative dentistry. So what is sterilization? Basically, sterilization is defined as a process by which an article, surface or a medium is freed from all microorganism either in a vegetative form or a spore form. Now then a difference comes, what is disinfection? So disinfection is a less lethal process than sterilization, and it is intended to kill diseases producing microorganism, but it is not the bacterial endospores. So it basically kills most life forms, especially pathogens, but not the spores. So according to guidelines given by CDC, first we transport the contaminated items from the operatory. Then we should have an instrument processing area where instruments are sorted, cleaned, then scrubbed and rinsed with water. Then they should be packed and they should be stored for events and sterilized and then stored. Then we should have environmental infection control like clinical contact surfaces, dental unit water lines should be disinfected and housekeeping surfaces should be disinfected. Non-regulated and regulated medical waste, that is proper disposal of the biomedical waste should be done. Monitoring plan should be there and a training plan should be there. So classification of instruments sterilization basically was given by Spalding's. The instruments can be classified as critical, semi-critical and non-critical. The critical instrument that penetrate into the sterile tissue. So they should be like blades or instruments or burrs. Semi-critical that touch the mucosa but they do not penetrate the skin, that is they touch the non-intact skin only. So basically these can be condensers, these can be handpieces, mouth mirrors or saliva ejectors. Non-critical just contact the mucosa like skin, not mucosa, pulse oximeter like light switches and dental chairs. These are non-critical instruments. Now sterilization process, it can be cold sterilization, it can be with the help of sporicidin solution for 10 minutes immersion basically, rubber dam clamps and extra film holders, tincture of metafin can be used or isopropyl alcohol, that is 70% can be used. Cold sterilization is not recommended for two reasons, because first it is not effective against all types of microbial life. The length of the time to destroy these microorganisms should be approximately 20 minutes. Then comes dry heat or Hall salt sterilizer that uses the principle of dry heat. The instruments that can be sterilized are broaches, files, reamers, paper points and pellets for 10 seconds. The content are basically for Hall salt sterilizer are 1% of sodium silicoaluminate, magnesium carbonate, sodium carbonates, which prevents clogging of the salts. But in a study that was given by Finlay, the temperature was 271 degree Celsius for reamers and files, which was sterilized in 9 seconds. So physical properties were not impaired, but they are not used for paper points and wool pledgets because they are brittle as they require longer time for sterilization. Advantages: this simple, safe and rapid method of dry heat sterilization. But disadvantage: every instrument is time consuming. Heating should be started 10 minutes before allowed to reach the required temperature. Difference in temperature in the well is superficially it is less than the deep layers. Then came glass bead sterilizer, which used glass beads for root canal instruments and paper points. Then hot air oven, that was a method of choice for root canal instruments like mouth mirror, tweezers, instrument holding forceps, excavators, root canal spreaders, etc. Handpieces were sterilized by hot air, which are placed in metal tubes, and working parts are coated with special heat resisting oil, and which is known as shell tellus oil, which was preparatory to sterilization. So the temperature was 27 to 90 minutes and the temperature at which it was operated was 175 degrees Celsius. Light loaded, it required 30 minutes at 160 degrees Celsius, and heavy loaded 1 hour or 2 hours depending upon the load at a temperature of 160 degrees Celsius. The advantages were: the complete kit sufficient for one appointment can be sterilized at a time. Content remains sterilized at least for a week. It can also be used for emergency treatment of acute conditions, therefore where few instruments are required, and it can also be used to sterilize large hand instruments. Chemical vapor sterilization, which is also known as Harvey vapor sterilization pressure method or chemiclave. One of the most popular method of sterilization in endodontic office. Here mixture of alcohol, acetone or ketone are used at a temperature of 132 degrees Celsius for a 20 minutes of time. Now comes the methods of disinfection. The various method which is most popular is boiling water, that is immersion in boiling water 10 minutes, but now it is not used because it causes rusting and loss of fine edges from cutting instruments. Then came antiseptic solution, which is used for solid non-absorbent articles such as metal or glass, but same, it causes rusting and solution can become caustic, therefore it was kept away from the patient and it should be rinsed with other solutions such as alcohol before use, but it is ineffective against hepatitis B infection. Cleanliness of the instrument is very important. The time required is 30 minutes, but longer time is preferred. According to government, disinfectants can be classified as low level, intermediate and high level. Low level disinfectants include quaternary ammonium phenolic compounds like iodophors. Intermediate level, which are used basically surface with blood like quaternary ammonium with alcohol, chlorines, phenols and iodophors, and high level which requires immersion of the instruments like glutaraldehyde or strong peroxides. So types are basically glutaraldehyde, chlorine dioxide, iodophors and alcohols. So disinfection techniques can be classified by ADA and CDC. Immersion disinfection, that is the instruments are cleaned by mechanical or ultrasonic units and then instruments are dried and before placement in the disinfectant they prevent dissolution. Then surface disinfectant, that is the countertops or surfaces are only sprayed with the disinfectant and left moist, so 80% effective. Then comes the decontamination of the dental unit. So it requires handpieces should be flushed for 20 to 30 seconds between the patients and several minutes at the beginning of the day so as to reduce the bacterial accumulation. Biofilm is formed in the dental water lines that can be by chlorination. Another approach is continuous use of flow, concentration of chemicals, and flushing will not only eliminate the biofilm, but yet a 20 to 30 second flush is recommended so as to avoid microbes from one patient to transfer to the other patient. So protective barriers must be used for covering the dental units like the handpieces, X-ray machines, the trays, the chair, as well as protective gowns, and N95 mask should be worn by the operator. So use of rubber dam should be there so as to reduce the risk of the areas. After rubber dam, we need to change the gloves. Chlorhexidine should be used, waterless technique should be used, and face mask and fiber type of mask are used. For films, we should use disposable film wrappings, paper, so as to avoid contamination of saliva, and they should be changed in each and every patient. Then reusable instruments, the gross debris can be removed by ultrasonic bath and the instrument should be either autoclaved or should be placed in the disinfectant bath. Disposable needles should be thrown and discarded after every patient use. Then we have, for verification, we have bacterial test strips so as to verify that we have reached the sterility, and basically they are used, the strips of paper with live resistant spores are used to check the, basically these are the indicators to check the system of autoclaves. Thank you.